I'm Cassie Thrasher. I am doing some basic first aid videos. I have watched all of my instructional videos and gotten permission to use a stuffed animal. So the first one I'm doing is for a possible fracture. So the first thing you want to do is have your animal on a flat surface. For transportation to the vet, you can put your baby on a towel, and then if it's a small animal, of course, you can probably just wrap them in a towel and brace the leg or whatever's wrong yourself. If it's a large animal, you can place them on a towel and then two people hold each corner of the towel. But we're gonna muzzle because it's probably painful, and painful babies bite, potentially. Okay. All right. We're gonna just keep him flat. This table is a little off, but so in order to get him transferred to the vet, we're just gonna do a modified splint. Ideally, this would be, we're gonna flip him over. Ideally, this would be just a tad bit shorter because we want the toes to be exposed. We're gonna put that splint on and we're gonna wrap from distal to proximal. Just enough to brace it till we get there. Not too tight, but that will help brace it until we get to the doctor. I'm Cassie Thrasher. I'm doing a video on how to do first aid on bleeding. I have gotten permission to use a stuffed animal. So what we're going to do first, wear gloves, mainly because blood could be coming from the animal, could be coming from a person that was handling the animal. So we're going to muzzle our animal first. In this case, it's a little dog. Anywhere that's bleeding on the body, you're going to want to apply pressure, regardless of where it's at, whether it's on the leg, on the belly, on the neck, wherever. Apply pressure for a minimum of 3 minutes. If you lift it up, if you just apply pressure for like 30 seconds, you lift it up, you're potentially pulling that clot away, and you're going to start the process all over again. So hold pressure 3 minutes and then you can check it. If it's a leg that's bleeding, you can hold pressure to 3 minutes. You can also, depending on where they're at, home, the office, or wherever, apply a tourniquet. This is just tape that is doubled over onto each other. You can tie it onto their leg if it's a leg that's bleeding, pretty tight, and then you would check that. Well, make sure your tape is not going to stick to each other. Check that every 15 to 20 minutes or so. Loosen it and check it and leave it off for about 20 seconds, and then you can reapply that tourniquet. But the main thing is to apply pressure. I think that's about it. Yeah. All right. Oh, I did watch the instructional video. I'm Cassie Thrasher. I'm doing a video on how to provide basic first aid for a pet that's been burned. And the first thing you want to do is apply muzzle. First thing I'm going to do is say that I've watched the instructional video and I've had permission to use a stuffed animal. But then apply muzzle. And If it's a chemical burn, you want to, if you're talking to the client over the phone and you don't know what they've been burned by, you could ask the client to bring the container with them to the office, or maybe they know, but you want to tell them to flush everything that's been touched by the chemicals with water immediately. Any other kind of burn, just apply ice water compresses to wherever the burns are, and then you'll take advice from your vet. I'm Cassie Thrasher. I'm doing a video on how to provide basic first care for a choking pet. I've watched the instructional videos and I've got permission to use a stuffed animal. First of all, if the client is at home and they're calling you on the phone saying that they think their pet is choking, if the pet can still breathe, then just have them keep the pet calm as possible and get them to the clinic as quick as possible. Signs of choking would be pawing at the mouth, gagging, and they can look down in their mouth to see if there's anything visible. If there is, you can take some tweezers or pliers or hemostats, if you've got hemostats at home, to grab it, but you don't want to push it down further into the airway. That could potentially cause more problems. If the pet collapses and can no longer breathe because of the airway obstruction, at that point, if they've collapsed, they'll be on their side anyways. But if it's before they collapse and if you can't get it out, you're gonna if it's a little guy, you can probably just use your hands. But if it's a big dog, you're gonna use both hands up under where the last set of ribs are, and just give a big push that causes a big gush of air, and hopefully to expel that object. If it, like I said, if it's a big dog, you're gonna be on the ground and pulling up towards you. If they end up collapsing and end up on their side, you can do the same thing while they're laying on their side and just use the palm of your hand and just push down and get them to have a big gush of air and expel that. And I think that's all. I'm Cassie Thrasher. I'm doing a video on how to do basic first aid for a possible heat stroke. I have watched the instructional video and I do have permission to use a stuffed animal. The first thing, if you think your pet is suffering from heat stroke, if you can, check their temperature. And you'll want to get some cold or cool wet towels, place over them, over their head and neck. You don't want to cover their ears, their eyes, their mouth, their nose. And then every few minutes, re-wet that with some cold water and keep placing that over them. And then once they get to the clinic, you can lay them over the tub and then run cool water over them, especially over their abdomen and groin area. And then continue checking their temperature. And when it gets down to 103.5, you want to stop the cooling process. It should keep on coming down. You don't want them to get too cold. I'm Cassie Thrasher. I'm doing a video on how to do basic first aid for a pet that's possibly in shock. I have watched the instructional video and I have permission to use the stuffed animal. The first thing you want to do is check their mucous membranes, color and texture. Check their capillary refill time. Anything 2 and under is normal. If it's greater than 2, then they have less perfusion. You can check their respirations, their heart rate, their temperature. You can listen to their heart, and while you're listening to their heart, palpate for a femoral pulse and make sure they're the same. You can palpate the femoral pulse while also palpating the dorsal metatarsal arterial pulse. They should ideally be equally strong and beat at the same time. If you have a strong femoral pulse and then a weaker dorsal metatarsal arterial pulse, your blood pressure is going to be around 80 to 100. If you have a weaker femoral pulse and then an absent dorsal metatarsal arterial pulse, then your blood pressure is going to be less than 80. And then if there's no urine output, then the blood pressure is less than 60. So check their heart rate, their temperature, and while you're listening, you can be getting the heart rate and the respirations as well, the beats per minute, the breaths per minute. If the dog or cat becomes unconscious, you want to make sure that they're laying flat. You don't want their head hanging off of well, this is a table. You don't want their head hanging off of anything. If they're in the back seat of a car, you don't want their head hanging off. You want it level with their body. And just keep them quiet and calm until we can get to the vet. I'm Cassie Thrasher. I'm doing a video on basic first aid for possible poison. If you're at the clinic and a client calls and tells you that their pet possibly ingested something that was poisonous, first of all, find out if they are a client. If they are, then you can pull up their information. You've got the breed of the dog, how much they weigh, the sex, the age, and everything you need to know about them right there. If they're not a client, then you'll want to get that information down. You'll also want to know what they ate or what they got into. You'll want them to bring the container, if possible, unless they ate it. How much they ate, what time they ate, and then you can take all of that information back to your doctor. And then if the doctor says that to tell the client that you need to induce vomiting, then you can tell them the instructions for that. Times that you would not want to induce vomiting would be if they swallowed something that burned going down, like bleach or other chemicals. Then if it burns going down, it's going to burn coming back up. So you don't want to induce vomiting for that. If it's something that's a little bit more serious, then your vet would be able to tell you, but you could give them the number to poison control for animals, and we have that written down. And then as far as anything else, you want to just make them an appointment to come in to see ASAP, preferably that same day, and bring any of the containers that they possibly could with them. They could have gotten into more than one medicine or chemical, whether they got under the sink, got into cleaning supplies, got into grandmother's medicines and tore open all the bottles. You don't know what they ate. So just bring everything that they can with them, but that they need to get here as soon as possible. I'm Cassie Thrasher. I'm doing a video on basic first aid for a pet that is possibly having seizures. I've watched the video, the instructional video, and I have permission to use a stuffed animal. The first thing that we want to do is make sure that they're on a flat surface. And we can also elevate their head with a pillow or a towel in this instance, just to keep their head just a little bit elevated. You want the environment to be quiet, decrease as much external stimuli as possible, put them on a soft surface, make sure there's nothing around them that they could hit, especially anything sharp. You want to time the seizures. You want to be able to tell your vet when they started and how long they lasted, and then transport as soon as it's safe for your baby to be in the car.